This is Colorado's Best, Denver's leading program about making your life even better, with Joanna Canals and Paula Haddock.
Thanks for watching Colorado's Best on Fox 31. I'm Paula Haddock. Bunions are not only painful, they're also unattractive and can interfere with your daily routine and physical activity, especially as you get older. At the Northwest Surgery Center, they offer a minimally invasive bunion surgery that you can walk out of with little or no pain. Joanna spoke with Dr. Jordan Sullivan, board-certified doctor of podiatric medicine, and Michelle Kuenstler, director of patient care, to learn more about the procedure.
It's the start of a new year. Everybody wants to feel better, and Northwest Surgery Center is going to make it happen. How are you, Dr. Sullivan and Michelle?
Hi. Doing great. Thanks for having us.
Definitely. I want to mention Michelle is in charge of patient care, and of course, Dr. Sullivan is the doctor. And doctor, we're going to start with you. We're talking about bunions today. Why do people need to have these corrected? Why do they seek this out?
Well, bunions are really a misalignment of the big toe joint, and it causes kind of a big bump to form on the inside of your big toe joint. And as that misalignment gets worse over time, you get a lot of rubbing and friction and inflammation of that joint. And it really can be debilitating to some patients. They can't do the activities they want to do, and they kind of interrupt their lifestyle. And then over time, they stop wearing the shoes they want to wear, and it just kind of worsens and worsens. So that's often why people need to get this fixed.
Yeah, it gets in the way. And, you know, people usually avoid surgery because they don't want the pain of it. But you perform a minimally invasive surgery. How is this different from the traditional approach?
Sure. So traditional surgery uses a larger open incision, like 6, 7, 8 centimeters long. Our incisions are all about 1/4 inch long, so they're much smaller. The advantage of that is we're doing a lot less dissection, so there's a lot less damage to the soft tissue. A lot less scarring and stiffness. The recovery is generally a lot faster because of that as well. And we also do that under a local anesthesia, so very similar to a dental procedure. So we're not having to use breathing tubes, no IVs, and the patients can walk out of surgery without being completely sedated. The patients can also do both feet at the same time, which allows patients to have one recovery period rather than multiple recovery periods for both feet.
That sounds amazing. So when is the ideal time to get bunion surgery, to have this corrected?
Yeah, so I never tell patients you have to have it done now. It kind of depends on the patient themselves. So once it's starting to disrupt your lifestyle and you're really not doing the activities you want to do, or if it's kind of rapidly getting worse, those are the two kind of signs that I look for to say that it's about time to get something done. There's also the factor of like how severe it is. The more mild the bunion is, the easier it is to correct for me, and the easier it is for the patient to recover from. So you're better off getting it done while it's an easier recovery and there's not multiple procedures that need to be done to fix the problem.
Yeah, absolutely. Now, Michelle, let's bring you into the conversation. You are in charge of patient care. Where do your patients normally come from, and what is the average age for this surgery?
Sure. That's a great question. Obviously, because we're located in Littleton, the majority of our patients do come from in the Denver metro area and all around Colorado. However, the unique techniques that we offer allows us to treat patients that are out of state. So we have a lot of patients come from out of state, especially since there aren't very many offices that offer this kind of technique. So anyone who's willing to make the trip out to Colorado, we love to have. As Dr. Sullivan said, a lot of factors go into bunion formation. So our patients range anywhere from 14 to 97 is our oldest patient. Most of our patients are in their 30s, 40s, 50s, and 60s, though, and they're exploring different options so that they can stay active later on in life.
Yeah, that's surprising that even as young as 14 years of age. Wow. So what is unique and special about Northwest Surgery Center?
Oh man, that's a big question. And I love that question. What's exceptional is our team. Our team treats every single patient that walks in here as if we're family. We treat each other like we're family. We have fun. We are honest. We go above and beyond to make sure that every patient feels comfortable and is happy and is feels very knowledgeable about what's happening with their process. We space out our appointments so we can take as much time as we need with the patient for them to feel comfortable, and so that we can get to know them on a personal level.
Yeah, you guys seem like a really great team. And I just think, you know, going into the new year, if you have this issue, why not get it taken care of sooner rather than later, right?
Right.
All right. We're going to give people some information so they can get a hold of you. Thanks so much for joining us today.
Thank you for having us.
Thanks a lot.
And for more information on this minimally invasive bunion surgery, call 720-704-2801. You can also visit them online at thebunioncure.com.